Hey Esties! Today we are back with another facial video, and we're actually entering into a season of corrective skincare. I want to talk to estheticians a little bit more about corrective skincare, how to treat certain diseases, certain disorders, the ones that we can actually work on. So this client originally scheduled an acne facial, and as you guys can see, this client does not have acne. And as estheticians, we cannot diagnose someone with acne. However, we know what acne looks like, right? So this client booked an acne facial, and my policy has changed since then. Now clients have to, they have to go through a consultation in order to receive corrective skincare, because people will just book, certain treatments, not even knowing what they have and what they need to get, So originally she booked an acne facial, but when she came in, I could see and feel that her skin was severely dehydrated, right? She was using a couple of things like benzoyl peroxide and, other things with like salicylic acid, things to treat acneic skin. But as I was touching her skin, I realized that her skin was not oily, not acneic, and actually severely dehydrated. So I just went in with the Dermalogica Intensive Moisture Cleanser. And that cleanser is really good for restoring the barrier. I'm just pre-cleansing her skin with this cleanser so that it can restore her barrier and increase the hydration in her skin. This cleanser not only is good for increasing hydration, but it also has a lot of anti-stimulants in it, like licorice, right? So it's hydrating the skin, but it's also soothing the skin as well. So I'm just working that cleanser and creating momentum, because as soon as I saw her skin, I knew, we're going to have to restore your barrier before we do anything, right? Before we, target some of the acne scarring. Right? Because just because you have a breakout doesn't mean that you have acne. And we all know breakouts, if you pick at them, if you don't treat them well, they lead to scarring. So there was a couple of things I did see on her skin. I saw that she had a few papules and pustules. I saw that she had a few scar tissue from previous breakouts. But more than anything, around her cheeks and her forehead area, and even a little on her chin, I noticed that she had a lot of irritation and inflammation, right? So that's really what we're targeting in today's facial. Now, I want to bring clarity to what acne actually is. Acne is an inflammatory disorder of the sebaceous glands, often caused by bacterial infection of Propionibacterium. This can start off as a clogged follicle with oil or dead skin, and then that could possibly lead to inflammation. We call that papules or pimple. If the pimple or papule becomes infected, then it leads to pustules. When that infection spreads under the skin, then that can turn into what we call cystic acne. And estheticians usually do not work on cystic acne unless it comes to a head. So this client does not have any of that going on right now. She has a little tiny bit of open comedones, right? Dead skin, oil just lodged into the pores, causing blackheads and things like that. Like I mentioned, she has a little bit of papules, which is causing that redness and that inflammation. And I probably seen maybe like one pustule, if even that. Maybe an old pustule that had already, extracted itself. Now that this client has a clean slate, I'm able to go in and formulate a treatment plan for her skin. The goal for today is to soothe her skin, but also decongest her skin. So right now, you'll see me mixing emergency soothing powder, which is nothing but oatmeal. And then after that, I'm going in with enzyme therapy, both by BioElements. So this exfoliating cleanser is going to decongest her skin, break down some of that keratin that might be clogging up her pores, but it's going to be soothing to her skin. The goal for today is not to compromise her skin, but rather stop the stimuli, right? Decrease that inflammation, but also make sure I go in and get whatever is compacting her follicles. So this cleanser, it is a gel cleanser. It is an exfoliating cleanser, but I added a couple of things in there like that emergency soothing powder to soothe her skin, because we want to effectively go in and get that congestion without causing any further inflammation. While I'm working this exfoliating cleanser in, I want to talk to you guys about compromised barriers. If you have ever studied under me or watched any of my videos, you've probably heard me say compromised barrier about 20,000 times. So what in the world is a compromised barrier? Compromised barrier is a term that we use to pretty much say that the barrier, the skin's barrier, has been broken or has been depleted. The skin is the whole body's protection, but the skin is so smart, it's so intricate and so intelligent that it produces its own protection mechanism. We call this the acid mantle. The acid mantle is a hydrolipidic film that has a pH of 5.5 and is made out of water and oils. It protects the skin against infection, pathogens, pollution, and then other invaders like free radicals. When that barrier is compromised or depleted or stripped, it causes the skin to be dehydrated, but then catch this, it also causes the skin to be exposed. And when it's exposed to pathogens, infections, pollution, and free radicals, it causes inflammation, it causes acne, so on and so forth. This is why it's extremely important to restore and maintain the skin's protective barrier. Because if somebody continues to strip their barrier and deplete their barrier, all because they're trying to heal acne or trying to get rid of acne, guess what? The acne is going to come right back. So I let this concoction sit on her skin. Now, the first couple of minutes, I let it sit under steam because enzymes are activated under heat and under moisture. So after I let it steam for a bit, I let it sit without steam because the enzyme therapy also has kaolin clay in it. So when you let clay mass set, it starts to absorb excess oil. And so I still, once again, did not see a lot of excessive oil, but if there was some there, I would have wanted that mask to collect that and get any excessive oil that may be trapped in her pores. And before we move on to the next part, I want to make something abundantly clear. Just because you feel a little tiny residue of oil on the skin does not mean that your client's skin is oily. Oily skin is considered to be an imbalance. But remember, the acid mantle is made of water and oil. So normal skin has a perfect balance of both water and oil. You know when someone has a good balance of water when their skin kind of feels like a damp sponge. And they have some tools that are helpful to measure out the hydration in somebody's skin so that you don't have to guess. There's a lot of different companies like Biotherapeutics that has a dehydration meter where it literally tells you the percentage of water in someone's skin. I recommend using something like that, but if you're going based off of your feeling, it feels like a damp sponge. It doesn't feel dry. It doesn't feel fragile. That's how you know somebody has a good level of hydration in their skin. But just because you feel a little tiny phlegm of oil or a little tiny film of oil, that does not mean your client is oily. You want normal skin to have a small film of oil. When it feels greasy, then that's when you know that the person has a little bit too much oil in their skin. Or when you blot the skin and then maybe 90 seconds later, there's oil again, or when it's clogging up the pores or clogging up the follicles to the point where there's comedones. That's when you know when someone has excessively oily skin. Now I'm getting ready to prepare my client's skin for some extractions. There are plenty of ways that you can extract your client's skin. You have manual extraction that requires you to use an extractor tool, your fingers, Q-tips, things like that. And then you have the vacuum that just suctions out the congestion. Then you have galvanic current. So what I'm using right now is the multi-active scaling gel by Dermalogica. I love using this product because it gives me slip whenever I'm using the vacuum, but it also saponifies the oils that are found in the skin. It turns the oil into soap, making it a little bit easier for that congestion to come out. Another thing I like about this product, it is also very soothing. It has aloe vera in it. So not only is it turning the oils into soap, but it's also soothing the skin before and after you do extractions. So I'm just working this product into areas where I know there could possibly be some congestion, like her nose, her cheeks, her forehead, and then her chin area. Just working it in to help it work a little bit faster by, using friction to saponify that oil. Nowadays, a lot of estheticians are getting away from using the steamer. However, I still use the steamer in the treatment room, especially during extractions, mainly because it opens up the pores. Some people do not believe that that is a thing, but I do believe that it opens up the pores and it makes it a little bit easier for that congestion to get prepared to come out. All right, so look at my vacuum piece. It's crystal clear before we go in, and now we're about to see what we can get out. When using the vacuum, you do have to be very, very careful. You have to make sure that the suction is not up too high, and you also want to make sure that your finger is following along with your suction. Sometimes people can bruise whenever you're using the suction. So there's a couple of things you have to make sure you are not doing and the client has not been doing before you use the vacuum. So a couple of things like blood thinners, consuming alcohol, consuming lots of caffeine. Just make sure your clients are not doing these things before you use the vacuum on them, because it'll cause them to bruise. It'll even cause a little bit of swelling. So you really do have to be mindful when using the vacuum piece on people who consume those things. And then also, too, you once again have to make sure you're using it properly. Some estheticians do not like using Decongestion solution when using the vacuum. And I think it's mainly because they believe the Decongestion solution fills up the tube more than the sebum does. However, when I do the vacuum, I'm not interested in so much of seeing all of the things that come out, but I want to make sure that I'm doing it in a way that's gentle for the client's skin, but then I want to make sure I'm doing it effectively. So I could really, if I could be honest, I could care less about what the tube looks like, because I'm more so going in to make sure that I'm effectively and safely getting that congestion out of the skin. And the Decongestion helps me achieve that. So even though when I look at that tube, I'm not only going to see sebum, but I'm also going to see the sebum collected in the Decongestion solution. That's fine for me, because once again, it does not cause harm to the client's skin, and it helped me work smarter and not harder. Sidebar: when you get into clinical aesthetics, relaxation low-key goes out the window. So something I like to say before I start extractions, I tell my clients, I'm getting ready to start some extractions. It's a little uncomfortable, so just let me know when you've had enough. This helps your client get a little bit mentally prepared for the pain or the discomfort that comes from extractions. Of course, it's my job to make you feel comfortable. However, we can't get away or get around this one. Extractions hurt. And if you're going to effectively get them out, it's going to cause a little discomfort. When using the vacuum, you want to keep the skin moist. So as you see me just going back in with a little bit more of that gel, just to give the client some slip on her skin. And then I'm going back in, proceeding with the nose. The nose is usually always the place where you find the most congestion. I don't know what it is about the nose. Maybe the nose has more follicles than everywhere else on the skin. But or specifically the face, but it accumulates so much oil. And this is for everybody, even some of the most driest skin types. There's always a little bit of congestion on the nose. There's always some blackheads on the nose. And sometimes you'll even notice that it's not a blackhead. Sometimes it could actually be hair. So when you're extracting on the nose, you do want to make sure you're looking at the skin before you go in and start extracting. Sometimes there's little hair follicles on the nose that can be tweezed out. I don't really recommend using Biore strips or wax to get that out. I usually just tweeze it out, and usually it'll just, come out with ease. The main priority when dealing with acneic skin is to decongest the skin. The reason why that's the main priority is, like we've expressed earlier in the video, if the follicles are clogged, that could lead to bacterial infection. That bacterial infection can lead to inflammation and can cause cysts if it's not dealt with. So this is the main priority of treating acneic skin or treating skin that's prone to breakouts. You want to make sure you eliminate that congestion. You want to give them a clean slate so the skin can actually start to thrive and start to heal itself. That does not mean that you have to get everything in one sitting. Sometimes you'll probably have to have clients come back to get multiple sessions. There are some clients where I actually have them schedule a decongestant facial every week or every 2 weeks, just so that we can get that congestion out in a safe manner. Some people actually can get it done in one day, but then there's some clients who have so much congestion that you'll probably end up having to take 2 to 3 hours out of your schedule. So I always recommend start your client on a regimen, give them some home care so that when they come back to you in the next week or two, you'll be able to effectively just decongest that skin. And you're working, once again, smarter and not harder. All right, so let's look at that tube. So as you guys can see, there is some of the desincrustation solution in there, but in there you can see it's mixed with some of the oil, the dirt, the debris that was lodged into her pores. And so I am satisfied with just that, but I think I'm going to go a step further and use some manual extractions just to see what else we can get to come out of her skin before we proceed to the next step. Really quick, let's talk about how to use this manual extractor. You don't have to push hard when you're using this extractor tool. The metal itself is kind of heavy, and so when you press onto the skin, they already feel a little bit of pressure. And so I'm not going to say don't apply any pressure, but you want to apply a gentle pressure. You don't want to go crazy when you're using this. You don't really have to. Using too much pressure could actually cause more harm than good. Remember, we talked about cystic acne and how it's pretty much under the skin. So if you're pressing too hard with your manual extractor tool, or if you're using your lancet and you're not being careful with your lancet, believe it or not, you could actually cause the infection from the pustule to spread underneath the skin. So when you're using a lancet, when you're using your manual extractor tool, use discretion, be gentle, but of course, you still need a little bit of pressure to guide that congestion out. Just be careful. After extractions, I love massaging my client's skin. And you may be thinking, why would you massage your client's skin after extracting? It's probably tender. It's probably very irritated. But believe it or not, I believe that massaging after extractions helps soothe the skin and restore the skin back to its natural state. If your client has like open wounds, I would say use your discretion. Don't massage on top of cysts, or don't massage on top of, open scars, open wounds. But if your client's skin is intact and if they're not too sensitive, I recommend massaging the skin. I usually go in with a massage gel, or I'll use a product that I've formulated called vanilla oil. I love using the vanilla oil specifically because vanilla is very antioxidant. It's very antioxidant. It helps heal the skin faster because it's a wound healer. And then it also helps hydrate the skin and then restore the skin's barrier. In addition to soothing the skin, I believe massaging the skin after extractions also helps prepare the skin to receive whatever you're putting on afterwards. So usually I'll leave the massage product on and then I'll layer a mask on top of that. That combination right there is my go-to whenever I'm trying to restore someone's barrier. Let's do a quick recap on skin histology. The skin cells are surrounded by oil. We call this a lipid bilayer. Skin cells in the center of the cell is filled with water. We know it's called protoplasm. But on the outside of the cell, there's 2 layers of oil. So I like to believe that massaging the skin with oil prior to putting on a water-based mask kind of mimics the environment that your cells thrive in. So what I like to do is I massage the skin with oil first, and then I go in with a water-based mask. This mask that I'm putting on her skin now is called the conductive mask. It's made with hyaluronic acid and algae. And I love using this right before I do LED light therapy because, as we know, water is a good conductor of energy. So it helps the skin absorb that energy from the LED light therapy. And in my mind, I like to believe that the oil that I massaged on top of the skin before doing this mask, it actually seeps through the water-based mask and then locks that hydration in and starts to insulate that hydration. This right here is my top secret to restoring someone's barrier because you want to restore the natural habitat of the skin cells, which is what we refer back to as the lipid bilayer. Just like we mentioned earlier, that acid mantle is made of water and oil. So we kind of have to create a habitat for the skin cells to thrive in. We kind of have to give it that push so that the skin cells can start to drink up that water and then have that water locked in by the oil. I let this treatment mask sit on for about 7 to 10 minutes under LED light therapy. LED light therapy is very pivotal when you are treating someone who has had a bad history with acne or is currently experiencing acne breakouts. LED could potentially reduce bacteria on the surface, soothe the skin, brighten the skin, and help build collagen. To conclude an acne facial, you usually want to follow up with water-based products, a toner, something that's going to be calming and hydrating to the skin, a serum, maybe vitamin C serum, or something with calming botanicals, and then a moisturizer that's just going to insulate all of that water that you placed in the skin. Stay tuned for more corrective skincare. I hope this video helped you. Bye.